Thank you very much, Senator Murray. And I want to say thank you for organizing this, and along with my co-hosts, Senator Baldwin and Senator Smith. So tomorrow marks the 4-year anniversary of losing Roe versus Wade. And in that 4 years, 21 states in this country have put in place either an outright ban on abortions or so many restrictions that they make it virtually impossible. And in those 21 states, instead of families and their doctors making really tough decisions, it's now a politician who's right in the middle of the decision and the principal one to call the shots. That's what 4 years without Roe versus Wade has brought us. Politicians who have a whole lot more power and brokenhearted mamas and daddies and doctors trying to practice medicine who all have a whole lot less power to get to the places that families need to be. So I'd like to start out, if I can, with you, Ms. McGill-Johnson. You lead Planned Parenthood, and you have called the defund policy that people have been talking about this afternoon just a backdoor abortion ban. So how is it that Republicans can threaten abortion access, even in states like mine, which protect access to abortion, but Republicans are figuring out how to block it? Can you say more about that?
Absolutely. Thank you, Senator Warren, for the question. I mean, clearly, this did not end with Dobbs. This did not end with their passion for denying us our basic bodily autonomy was not just about returning the decision to the states, to the politicians in banned states. It was about trying to find any and all means of limiting access to care. And so the defund provision in the H.R. 1 last year that was signed into law was designed to restrict patients from using their Medicaid insurance at Planned Parenthood health centers. Now, we know a lot of states, particularly those states with bans, never expanded Medicaid under the ACA, so they weren't able to, so at the time did not have the same impact. But many states that have abortion access expanded access to Medicaid, and is where many of our ability to provide access to abortion exists. So since that defund provision went into effect last year, we have lost about 50 health centers in 50 health centers over the last year, 20 since the defund provision. And so the impact of that means that the states where, where abortion access exists, are losing access to Medicaid funding, have lost access to Medicaid funding, while some have been backfilled generously by their states. It has impacted their ability to continue to provide abortion care in the same way. Okay. So that was why we called it a backdoor abortion ban.
Today we're looking at a fiery Senate hearing where Senator Elizabeth Warren delivered a passionate defense of reproductive health care access and sharply criticized policies she says are restricting care across America. The hearing comes as the nation marks 4 years since the overturning of Roe v. Wade. Warren argued that the consequences are being felt in communities nationwide, particularly among women, families, and healthcare providers. We'll break down her key arguments, the testimony from healthcare leaders, and why this debate continues to shape American politics. Let's get into it.
25,000 patients lost access to birth control, and nearly 75% of Planned Parenthood closures occurred in rural and medically underserved areas. So this is not just targeting abortions, this is targeting women's lives all across this country. Would you like to say more about that?
Absolutely. I mean, and again, that was the intent of the bill. The intent of the bill was to, was to harm women, right? It was to harm patients at Planned Parenthood, and it was to harm a provider that has stood up strongly and vocally against this administration's policies, right? So it was a targeted political attack, not only that had the consequence of also impacting millions of women across this country.
Right. So attack to the health of women and to silence the women who speak up on their behalf. And, it's not just Planned Parenthood. Planned Parenthood has drawn a lot of the fire, but 2 independent clinics, Health Imperatives in Massachusetts and Maine Family Planning, have also been swept up in the Republican attack. And we are very glad, welcome, thank you. We have Ms. Kiltika, you lead the Maine Family Planning in one of the most rural states in America. President Trump and congressional Republicans have forced you out of Medicaid. Can you just say something about how that has affected the communities that you serve?
Well, so it's been effectively said, this has never been just about abortion. It's about creating chaos in whether or not patients can access any sort of sexual and reproductive health care. And it certainly impacted us in Maine. It is attempt to already put a strangle around what is clearly essential health care in what is in the midst of a healthcare crisis. So as I said earlier, we had to close 3 primary care practices in our most rural parts of the state, affecting 1,000 patients. And it's created disruption for our family planning patients. When Dobbs fell, and with this, and most recently with the Medicaid ban, and our patients heard about that, the phone was ringing up at our call center to say, "Can I still get access to care? What does this mean for me?" To the point that generally, always personally, what does this mean to me?
Right. And if I can just slip in one more point here, while Republicans in Congress defund legitimate health centers like Planned Parenthood and Maine Family Planning, what are they offering instead? The Trump administration is spending your taxpayer dollars on a new government website called moms.gov that claims to help new and expectant mothers, but in fact is promoting anti-abortion crisis pregnancy centers. Ms. McGill-Johnson, I've run over my time here, but can I ask you, just to make the point, is the Trump administration steering women to real healthcare providers?
In limited time, no.
Can she have a more?
Crisis pregnancy centers do not have the same obligation to speak the truth and to give medically accurate information to women. So they are steering dollars, taxpayer dollars, to misinformation and is harming women in communities.
So it's misinformation, but does anybody get hurt by this misinformation?
Yes, people get harmed all the time when they are not allowed to make decisions about their own bodies, when they are being, given kind of fake ultrasounds about where they are in their gestational period, and then being delayed access to real abortion providers when they have stated that that is what their preference is. So yes, they are being harmed.
Yeah. So look, here's the good news. Republicans in Washington are trying to sneak through these backdoor abortion bans because they know that the American people are not with them. The voters don't like their extreme agenda. If they liked the agenda, they'd be out here doing it in public. Instead, it's these alternative ways. And because they know we have the power to push back, and that's the part we have to remember. What's happening is terrible. But what's also happening is that we are more and more determined than ever to push back. Decisions about abortion should be made by the patient, the doctor, the family that the patient wants to bring in, and not by some politician.
Don't forget to like, comment, and hit the subscribers button for more political and controversial showdowns.